When it comes to developing a flu vaccine, researchers must take aim at an invisible target. Not only are flu viruses constantly changing, but drug manufacturers need to start producing their vaccines 4 to 6 months before the flu season starts. That means that scientists must predict which viruses will be the most active and in which month will be the most active before it ever appears. Let's learn a little bit more about this from Dr. Al Johnson, who is a 1320 WILS and Fox News Radio medical expert. He's a doctor of internal medicine. Dr. Johnson, how are you, sir?
Excellent. Good morning.
Talk about a tough gig. You're trying to produce medicines for something you think will affect a lot of people, and you're trying to do that before it happens. It could be tricky business.
Exactly. It is tough to predict a lot of times, and the CDC takes a look at what's around the world and then comes up with a group of viruses that they think will be prevalent the next year.
This past Thursday, the director of the Centers for Disease Control and Prevention warned that the flu shots and nasal sprays distributed this year may not be a good match for most active viruses now circulating around the U.S. How could they get this wrong?
Well, they just predicted wrong, and what happens, viruses change a little bit antigenically, and so it may be the same type of flu, but a little different strain, and therefore you're more susceptible to it as you don't develop full immunity from the shot. This year's shot has the same virus strains as last year's, and it's off just a little bit.
Dr. Johnson, is there any benefit to getting the flu shot when we have these kind of challenges?
Yes, there is, because what we see is it does give protection to the viruses that are in the shot, and it does give some protection to those that may be slightly different, because it does stimulate your immune system in general, but it does also stimulate specifically, like it has H1N1 in it, which was the bad flu virus in '09 when everybody got sick. So we aren't seeing it. Excuse me, though we're seeing a little different variant of type A. And the message is take your flu shot. If you're one of those people that are immunocompromised or on immunosuppressive drugs or have frequent infections, you may get a secondary bacterial infection and need to be on antibiotics at the same time. So there is flu drugs that the doctor can prescribe for you, plus you may need to be on the antibiotics to prevent the secondary infections.
Doctor, what's the best way to keep from getting sick or to shortening the life of the flu this winter?
Well, the best way is, don't be in crowded environments. Wash your hands, because you typically spread it directly. Wash your hands frequently. And if you're one of the susceptible people, then you want to stay out of the crowded environments.
We've been talking with Dr. Al Johnson, who's a 1320 WILS and Fox News Radio medical expert. Dr. Johnson, thanks so much.
Oh, you're totally welcome.